Hello, I'm Dr. Tim Lemire. I'm a general surgeon at the Minnesota Reflux and Heartburn Center, and today I'll be talking to you about acid suppression. Medical treatment options. This includes acid suppression. They either buffer or they decrease the acid production. Antacids are buffers that neutralize, coat, and soothe your stomach. These include things like Maalox, Mylanta, and Tums. This can also have an effect on the reflux or heartburn you may be feeling. H2 blockers are medications that reduce the acid production, but these can be 60% ineffective in some patients. H2 blockers include drugs like Zantac, which is currently off the market, and we do not recommend using it at this time, Ppis, and Tagamet. None of these drugs stop the reflux. They only buffer or decrease the acid. Acid suppression is a complete reduction in acid production. These include Ppis, or proton pump inhibitors. These reduce acid production by completely blocking the acid pump in your stomach, so there's no acid production to cause the reflux. These include drugs like Prilosec, Prevacid, Protonix, Acifex, Nexium, and Dexilant. All of these work by the same mechanism, but changes in these drugs per patient are based on insurance coverage and side effects.
Hi, my name is Dr. Sean Roberts, and I'm one of the general surgeons and foregut surgeons here at the Minnesota Reflux and Heartburn Center. Today I'm going to be talking with you about what happens after you've completed your initial workup and what are the different medical therapies for you. The problem with taking these medications your whole life is that acid suppression can have other things. Probably the biggest thing is that people develop breakthrough symptoms. So while you're taking medications, you might be taking it once a day, but get breakthrough symptoms in the afternoon or evening. Some of those breakthrough symptoms require taking a second dose or, again, adding an additional therapy. As you can see, some people will require taking additional medications fairly frequently, several times a week even. And again, as we approach double dose therapy or adding additional therapies, that's when we start talking about failure of management. What we also know about reflux medications is they don't stop reflux. They are heartburn medications and they can help the symptoms. They typically decrease the amount of acid that is produced in the stomach, and so the content that is coming up from the stomach into the esophagus is not as acidic, and so a lot of times they help with symptoms, but they don't actually stop anybody from refluxing. They just change what the reflux is, so they mask the symptoms. And again, most of these medications, as they were trialed and did FDA approval, they were approved for up to a couple of weeks, and most of the time the package insert will say that. So they were never really designed or indicated for long-term, lifelong use. We do see people that are on these medications for years and sometimes even decades, but we do always have those conversations with people about some of the long-term side effects that lead to being on these medications long periods of time. We do sometimes see disease progression despite being on medication, so it is important any kind of change in symptoms or sometimes just routine follow-up is indicated for people on lifelong medical therapy to make sure that we are not disguising precancerous changes or certainly esophagus cancer. PPIs do have some risk. Acid does play a role in your body, and it changes how some elements are absorbed, such as calcium, and so sometimes we can see osteoporosis associated with that. We mentioned dependency, which means that you just need more and more of the medications over a period of time. Certain vitamins are also not absorbed as well, so we will see deficiencies of some of these minerals, iron and magnesium as well. That can lead to electrolyte abnormalities and cause actually heart rhythm problems, usually related to low magnesium. Chronic diarrhea is sometimes seen with PPIs in particular, and changes in the makeup of the colon bacteria can sometimes lead to Clostridium difficile infection, which is a fairly significant and sometimes severe cause of chronic diarrhea in patients. We will see kidney troubles with the PPIs in particular as well, reaction with various types of medications that you might be on, increased infection risk, particularly for hospitalized patients associated with PPI use, and there's even been some association with dementia and stroke. So these are all conversations that we have with people, and that's part of the individualized therapy that needs to be done. When we start looking at your test results and looking at the various medical options, trying to determine what the best option is, evaluating the safety profile of these medications, and I always try to get people on the least possible effective dose that manages the symptoms when we're talking about sticking with medical treatment.